I'm Dr. Kenny Levine with Health Talk. We're streaming live on the web at www.tvchannel19.com. Again, I'm here with Dr. Abby Wilentz, pedodontist to the stars, pediatric dentist. Abby, do you ever have children that come to you who had been to a dentist who were traumatized and now they ask them to see you?
All the time, and that's the hardest part. Once you lose a patient, and you probably know this as well, it's very hard to win them back. So that's why our specialty, I think it's a gift for the child, because we give them confidence, because hopefully for the rest of their lives, at a minimum of twice a year, they're going to see a dentist.
Right.
So we try to guide the patient to be very confident and to not be scared about going to the dentist.
Can we talk a little bit about malocclusion and bad bites and interceptive things what is the recommendation now relative to early treatment, delayed treatment, and do you get involved with it as a pedodontist or is it only the orthodontist?
No, absolutely, and I think that's the beauty about pediatric dentists, because when we see a patient, get a minimum of twice a year, we could capture and guide their growth and development. So after we give them their examination, we could talk to the parents and discuss with them when the appropriate time is to refer them to the orthodontist. And it's not so much more chronological age, it's more dental age, because children are losing their teeth, are much more advanced now. They're losing their teeth at a much earlier age. Okay. So the American Academy of Orthodontics recommends, I think now it's around age 7, that a child should be seen for the initial evaluation with the orthodontist, and we could guide the parent and to find a fit that's good for their child.
Before I forget, I want you to be able to tell everybody where they can find you, your address, your phone number, website, things like that. Let's get that in right now.
Our office is located in Plantation. It's the address is 7400 Northwest 5th Street. Our phone number is 954-581-7883. And not only do I work with my dad, Dr. Trepkin, I also work with Dr. Jason Hirsch, and we also have Dr. George Babiak, who's the orthodontist in our office.
Jason's a pediatric
dentistry.
And George is an orthodontist. Correct.
So the beauty of our office is it's pretty much, we all work as a team, and it makes everything very easy for the family.
But if somebody had a relationship with another orthodontist,
absolutely,
you work with many orthodontists in the community.
And once you as a pediatric dentist, you kind of get to know the patient and the family, and there's a lot of wonderful orthodontists in the area. So by knowing your patient, you could, because an orthodontist is, it's a long-term commitment, it's a long-term relationship. So you could try and find a correct, the best fit.
Match the personality, the best fit kind of thing. It's, we treat patients in our practice. I treat children of all ages. We treat them for gum recession problems. We treat them for frenums or muscle pulls. We expose impacted teeth for the orthodontist. We get rid of gummy smiles. We add gum tissue. So I do have a lot of experience with children. Talk about sedation for the anxious patient. How's that handled in your office?
And again, not a lot of offices do sedate children anymore. And I think it's really a gift to the community that our office still does, because not only is it so much fear and anxiety, if a child does need a lot of dental work or a lot of dental rehabilitation, then we have, by law, we can't completely put anyone completely to sleep in our office, but we do offer conscious sedation, and typically we use Versed. It's like a benzodiazepine, and the patient's typically awake. And it's not a magical drug, but what's nice about the Versed, there's a property called retrograde amnesia. So really the patients don't really recall what goes on during the procedure.
What is that called?
Retrograde amnesia.
Yeah,
so
I
their
tell
memory
them
is
they
pretty
can't
altered.
remember it.
Exactly.
I use the same drug with another one when I sedate my patients. Can you talk a moment about
And then we also use nitrous oxide too.
Let's talk about the importance of retaining baby teeth and what deciduous teeth as we know it. Why is that important?
It's so important because a lot of the times when you see a child and you give them an oral examination, or you look on the radiographs and you do diagnose cavities, and you explain to the parent, well, they have to come back for fillings on baby teeth, and they're like, but I don't understand why, because they're going to lose it.
Right.
Because the best spacer you can have is a natural tooth, and cavities grow at a much more rapid rate compared to adult teeth. And a lot of times when you see a child, sometimes 3, 4, 5, sometimes even younger, when they do have cavities on their baby teeth, the cavities are not going to outlive the teeth. So that's why it's very important to maintain a healthy healthy teeth on the primary
You
teeth.
know, I've worked with you and your dad for years. I learned an awful lot tonight, and we're going to do this again. I'm Dr. Kenneth Levine. You can visit my office at www.drklevine.com. You can come to my office for a completely free, complimentary examination, consultation, and radiographs. I look forward to seeing you. Have a good night. Thank you.